A ton of questions and comments lately about Accutane, people being concerned about themselves or their friends or family members being on this medication. I'm going to give you the perspective of what we believe in dermatology with Accutane. Now, often when I see patients like this in my clinic, they have tried and failed oral antibiotics, sometimes spironolactone if it's hormonal, and as well as topicals like tretinoin and clindamycin. When nothing else works, Accutane is a good next step. Accutane is essentially a synthetic form of vitamin A that you would take over the course of about 6 months. We start sometimes once a day and work you up to twice a day. Sometimes you start off right off the bat with twice a day. Now, everyone is always very scared of the side effects of Accutane. So what are the side effects? The main two that we see are excessively dry skin and you are very sensitive to the sun. Sometimes, but not all the times, you can get a little purge when you first start the Accutane. Occasionally, it can be a severe purge depending on how high of a dose you start. At higher doses, it can cause some dry eye, it can cause some muscle pains like joint pains, things like that, and it could also cause hair to fall out because it is a medication. Taking medicines can make our hair fall out. Now, a very big one is it causes severe birth defects if you were to get pregnant on this medication, which is all the hubbub with Accutane. When you come into our office, we give a big long spiel about how you cannot get pregnant when you're on this medication. Another big side effect is the mood changes. Now, the American Academy of Dermatology has come out and said that Accutane is associated with mood changes, such as improvement of the mood, not worsening of depression or anxiety. Now, when we hear our patients say that they have depression and anxiety while taking Accutane, we take that very seriously and we lower the dose or sometimes take them off completely. But the American Academy of Dermatology has stated very clearly that more studies need to be done to explore this, but at the current time, there is no link between Accutane and depression and suicidal thoughts. If you're struggling with severe acne and nothing else seems to be helping, Accutane could be a good option for you, but this is a discussion between you and your dermatology provider.